A hearty good afternoon and welcome to a session on Unexplained Infertility. We're glad to have Dr. Dhivyambigai Rajendran among us today to help us explore this topic. Unexplained infertility can be caused by a variety of factors like nutrition, lifestyle, genetics, and more. It takes a lot more to probe to also understand what could be the reasons for such. A variety of tests to understand the causes of unexplained infertility and more. So it's important to understand this and don't hesitate to ask any questions or clear doubts with our doctors. So, doctor, you have the stage.
Thank you. Hello all. Good afternoon. I am Dr. Dhivyambigai, fertility specialist working at Apollo Fertility, Karapakkam, Chennai. Today, my topic on discussion is unexplained infertility. What next? So, I'm going to discuss about what is unexplained infertility and what are its treatment options. So, the term infertility is considered when the couple is not able to achieve pregnancy after trying for 1 year. After trying for 1 year, then we call them like they are having infertility. So, once these couples, after trying for 1 year, when they come to us, we recommend certain standard fertility evaluation tests. So, for male, we do semen analysis where we check for the sperm count, motility, and morphology. And for the females, we do three important fertility evaluation tests. First is the hormonal profile, which is basically done on day two of their periods, and the ovarian reserve test, anti-Mullerian hormone, and the thyroid function test and prolactin levels. These are the hormonal checks we do, and a scan, which is called follicular study. Follicular study is a transvaginal ultrasound where we check for the egg growth and egg release. The process is called ovulation, and we do tubal patency test. Tubal patency is to assess whether the fallopian tubes are open or not through a dye test. The name of the test is histosalpingogram, in which a dye is injected and then following that a X-ray is taken to assess if there is free spill of dye from both the fallopian tubes. And another method of assessing tubal patency test is a laparoscopy procedure, where it is a surgical procedure where a methylene blue dye is injected through the cervix, that is the mouth of the womb, and the spill of the dye is visualized directly through a laparoscope camera inserted through the abdomen, and the spill of the dye is visualized. So these are the methods to assess the tubal patency. So after doing these basic fertility evaluation for both males and females, so we see like 15% of the couples, among the couples who are undergoing these tests, 15% of them, all these reports are found to be normal and there is no apparent cause for their infertility. So in many couples, we do see minor abnormalities in these tests, and but they are not severe enough to cause infertility. So basically, these are the couples where the infertility is referred to as unexplained. Unexplained meaning we are not able to find out a reason for their infertility. So unexplained infertility is actually a diagnosis of exclusion. So after a thorough history taking, detailed examination, and running through all these fertility evaluation tests, if everything is found to be normal and we are not able to find out the reason, then we call them as unexplained infertility. So, in couples with unexplained infertility, the problems could be due to their egg quality or the sperm function or the tubal function. These are the things which are not assessed through our routine fertility test, and these are the things that are very difficult to diagnose and treat as well. So, these could be the reasons for their unexplained infertility. So this for infertility per se is very stressful and creates lots of anxiousness in the couple. Coming to unexplained infertility, it is even more stressful and it's causing emotional, affecting their emotional and psychological well-being. So first thing is we deal with this couples of unexplained infertility with empathy, and we give them psychological support through counseling, and then we'll be discussing about the treatment options available to them. So coming to the treatment options, First and foremost is the lifestyle modifications. In this modern era where we have like sedentary lifestyle, lack of physical activity, and abnormal eating habits, eating lots of junk foods, leading to overweight and obesity. So worldwide, obesity is on the rise, and we do see people with being overweight and obese are quite common nowadays. And this obesity affects fertility. So generally, to know if your weight is appropriate for your height, we have a body mass index calculation, that is BMI calculation. So if your a high BMI denotes being overweight and obese. So this excessive weight, especially excessive abdominal fat, causes abnormalities in the egg growth and egg release in females, and contributes to low sperm count and low motility in obese men. So, first step towards achieving proper fertility, first step towards improving your fertility would be to keep your weight appropriate for your height. So, concentrating on a low calorie diet and doing your regular exercise would help to improve your fertility treatment outcomes. And apart from this, we do see like the personal habits like smoking, alcohol also has adverse effects on the eggs and sperms. So, where couple who are actively trying for pregnancy, if they are having any of these personal habits, they should be like considering quitting smoking and alcohol to improve their fertility outcomes. And then next, coming to this, after this lifestyle changes, the options are like treatment options are, one is like expectant management. Expectant management is just with the lifestyle, try to continue try on their own. So this expectant management is considered in couples who are young, especially female partner when the age is less than 30 years and they have a good ovarian reserve. We do assess this anti-Mullerian hormone. If they have a good reserve and no other risk factors, no other underlying risk factors which could affect their fertility. These are the couples. The young couples are can continue to try on their own through regular intercourse for another 1 year with lifestyle changes. So, but the chances of them being getting pregnant at the end of one more year of trying. So, first 1 year of trial only, they are not able to achieve, and they come and then we do the investigations. After the investigations, if everything is found to be normal, then we just recommend in young couples, only in selected couples, in young couples with good ovarian, with female partner with good ovarian reserve, they can try for one more year, and they can try this with along with their lifestyle changes. So the chances of pregnancy in the next 1 year of trying naturally is 10%. So for couple, the next treatment option would be like ovulation induction with intrauterine insemination. Ovulation induction is a process where medications are given to promote egg growth and egg release, which is monitored through follicular study, the scan, which will be done on alternate days or daily based upon the the follicle size, and then at the time of ovulation, intrauterine insemination will be performed. So through this method, people with couples with unexplained infertility, the chances of them getting pregnant per cycle of IUI is 20 around 20%, and there is a cumulative pregnancy rate. Cumulative pregnancy rate is that when they try for 3 to 6 cycles of IUI consecutively, at the end of sixth month, the pregnancy rate would be around 50%. So this is one important factor which the couple should be aware, because most of these couples who are like anxious and when they are undergoing treatment, it's again a stressful situation and they're expecting the results whether they are pregnant or not. All those things matters. So they do, like if they get a failure in the first cycle, they do get dejected, and then they are not willing to continue their treatment, and they do take some breaks. They wanted to take a break and then come back for future treatment. So usually we recommend that they not to give up on the first cycle itself. There is a failure in the first cycle, not to give up and to continue treatment, so that the cumulative pregnancy rate, when they consecutively try for 3 to 6 cycles, the chances of them getting a successful pregnancy is higher. So that's what, like, every couple should be aware of this cumulative pregnancy rate as well. So per cycle it is 20%, and cumulative pregnancy rate for 6 cycles is 50%. And so, for couples who have not been successful in IUI treatment, the next option is in vitro fertilization, IVF. In that, we have an advanced technique called ICSI. It is nothing but intracytoplasmic sperm injection. In this technique, a single sperm is injected into the egg, thereby ensuring fertilization. So commonly, this unexplained infertility, we said, right, the problem could be because of the poor oocyte quality, poor egg quality, or sperm function. So here, the fertilization, the process is like ensured through a technique called intracytoplasmic sperm injection. So we get good fertilization rates with this technique, and it has been very successful for couples with unexplained infertility. IVF is an expensive process, but then the success rate is better compared to other treatment modalities, especially in unexplained infertility. So, in general, a couple with unexplained infertility, the care is given holistically, and then all the way treatment options are considered pertaining to their age and other investigations. Especially in women, we do consider this AMH, anti-Mullerian hormone, which tells you about the number of eggs remaining in the ovary. So if it is like a less AMH, that means a low AMH, especially less than 1, that means a poor ovarian reserve. That it signifies they have a very shorter window to get pregnant. So for those women, early initiation of treatment, fertility treatments, and early initiation of IVF treatment would be beneficial to get good pregnancy rates. So, the take home message would be unexplained infertility is a stressful situation, but then when dealt with proper care, we can get good pregnancy rates. Thank you. Any questions we can discuss? Thank you all. And if any questions, we'll address them later.